By now, you've probably heard about the tragic hyperbaric therapy accidents that occurred in this past year. As a result, you might be wondering, is hyperbaric oxygen even safe? In today's video, I'm going to address what we know about those accidents, what happened, why they happened, if they were preventable, and I'm going to give you a list of questions that you might want to consider asking the clinic you're going to make sure that they are following proper safety procedures. If you're new to this channel, I'm Dr. Jason Saunders. I've had over 20 years of experience inside the hyperbaric industry working with patients. I also train, certify, and educate practitioners and technicians in hyperbaric safety, compliance, procedures, protocols, and operations. In all of the years that I've been involved in hyperbarics, and in all of the years that I've been teaching hyperbarics, I've been able to say inside my classes, it's been over 20 years since the last catastrophic hyperbaric accident, until this past year. This past year, we had 2 catastrophic accidents in this industry, leading to a loss of life. These outcomes are tragic and unacceptable. They warrant careful and serious examination and understanding what happened in these scenarios so that that can be avoided in the future. In fact, we review almost all of the hyperbaric accidents inside my courses because we need to learn from the mistakes of the past so that we don't have the same mistakes into the future. Let's start with the fact that hyperbaric oxygen is a medical therapy. And with all medical therapies, there are risks and benefits, and it's our job to weigh the risk to benefit ratio and understand if it's an appropriate therapy to be delivering to any given patient who's wanting to receive this treatment. Again, in our courses, we spend a lot of time talking about pathophysiology of a range of different conditions, and then mechanisms of action of hyperbaric oxygen so that we can make solid clinical decisions. Do the mechanisms of action of this therapy help this patient gain the results they're looking for based on my knowledge of their pathology or their health concerns or health issues or health goals? If the answer is no, then hyperbaric is not the right fit. And if the answer is yes, then we can say, let's move forward with a protocol, monitoring along the way, making sure that the patient is tolerating the therapy along their course of care, and that at every turn, we are minimizing their risk while trying to maximize their benefits. The one thing that I can say consistently across the board as we're evaluating all of the hyperbaric accidents of the past is that they were all avoidable. They all come down to operator error or contraband in the chamber, things that shouldn't have been brought into the chamber in the first place. The hyperbaric industry is expanding rapidly, especially over the last 3 to 5 years. There are more equipment options today than ever. Some of that equipment is approved and safety certified, while others are not. There are more clinics opening up today all over the world than ever before. There are more hyperbaric sessions happening today than ever before all over the world. And for that reason alone, statistically speaking, the risk for accidents to occur is much higher. And with all of that growth, there has still only been 2 of these types of accidents in the past 20 years. That's not to minimize those accidents. It's not to minimize the loss of life and the impact that that has on the families who experience those losses. It's simply to point out that when comparing hyperbaric oxygen therapy as a medical intervention to almost any other medical intervention that I can think of, including a range of different drugs and surgical procedures, the safety track record of hyperbaric oxygen is actually pretty high. The reality is that hyperbaric is consistently a very safe tool. When the equipment is certified from a safety standpoint, when the equipment is being maintained consistently based on the manufacturer's recommendations, when the operators are utilizing appropriate techniques for pressurizing and depressurizing the chamber, when the policies and the procedures of the clinic are all in line with the compliance of the hyperbaric industry, hyperbaric tragedies are incredibly rare. But when mistakes are made in any one of those categories and an accident does occur, unfortunately, those accidents are almost always catastrophic. Again, learning from those past accidents so that we're preventing future accidents is critical, and more critical today than ever before because of all of the growth inside the hyperbaric industry. Before we get into some of the details of those 2 accidents, I do want to bring attention to the fact that I have delayed doing this video. And I've delayed the video for a number of reasons. One, I want to make sure that anything I say in these videos on this channel is as accurate as possible on any of the topics that we talk about. So in no way, shape, or form was I willing to speculate on ideas or concepts that I didn't have full awareness or knowledge of. In fact, even today, There are certain things that we know for sure, while others are still speculation, and so I will not comment on anything outside of whatever the investigations have revealed to date. I also feel very strongly about not minimizing these accidents or being insensitive to the loss of life and the impact that that has on the families affected. But at this time, I feel like I have enough that I could at least share the basics of what happened so that, again, we can use that information to avoid future accidents. While both of these accidents did end with a tragic loss of life, the circumstances around both of them were vastly different. And in fact, the equipment being used in both of those situations was also very different. Some chambers are pressurized with oxygen. Some chambers are pressurized with air. There are some similarities between both of these chambers. In other words, you're still being exposed to pressure and you're still being exposed to oxygen. However, the internal environment of pressurizing 100% oxygen and the internal environment of pressurizing air are vastly different environments. As a result, the equipment that is built in both of those cases is also built to slightly different specifications. Let's talk about the accident in Michigan first. The Michigan chamber was pressurized with 100% oxygen. With that equipment, there are a few requirements. So the metal components of that chamber itself needs to be grounded to its own grounding source, similar to the way the electrical panel in your house or in your building needs to have grounding. That chamber needs to be directly grounded. In addition, because it's a 100% oxygen environment, the patient needs to be grounded as well. And the purpose of that is to decrease any potential static electricity inside that chamber, because even a very small static spark in a 100% oxygen environment could and likely will create a flash fire. Just like any hyperbaric chamber, regular maintenance on that equipment is critical. Maintaining and logging that maintenance is paramount to making sure that you're remaining compliant with your usage of that chamber. In addition to grounding the patient, there are other steps to try to minimize any type of static electricity inside that chamber. The sheets need to be 100% cotton. The pillowcases need to be 100% cotton. The pillows and the mattresses need to be fire retardant. The clothing that the patient wears needs to be 100% cotton. We need to add humidity into that chamber to decrease the threshold for where static electricity might become a problem. And if the chamber is grounded and the patient is grounded and 100% cotton is being used throughout the chamber and the humidity is appropriate, the likelihood of a static spark igniting a fire is exceptionally low. I can't say zero, but as close to zero as we can make it. And hyperbaric oxygen chambers have been utilized in that way for decades. And when done properly, the safety of that chamber is incredibly safe as well. What do we know about this particular situation? We know that the patient was not grounded. We also believe that the patient wasn't wearing 100% cotton clothing. And there was a blanket inside that chamber, which was also likely not 100% cotton. So there were at least 2 or 3 definitive deviations from standard of care with regard to managing patient safety in that chamber. And in fact, that chamber accident has been deemed a static electrical spark that created a flash fire, leading to that loss of life. Let's talk about the accident in Arizona. That was not a 100% oxygen environment. That was an air pressurized chamber with oxygen flow from an external source. I believe in that case, an oxygen concentrator. In that type of chamber, typically the chamber itself is still required to be grounded the same way the 100% oxygen chamber needs to be grounded. One difference is the 100% oxygen chamber, the patient is required to be grounded. In the air pressurized chamber, the patient is not required to be grounded. And so therefore, in that case, it's likely the patient was not grounded, but also didn't necessarily need to be. I'm not sure at this time whether the chamber was grounded or not. I also don't believe that whether the chamber was grounded or not would have impacted the outcome of this particular accident. Another very important rule and regulation inside the entire hyperbaric industry: there should never be battery-operated electronics inside of a chamber, period. Whether it's pressurized with 100% oxygen, whether it's pressurized with air, whether it's a monoplace chamber or a multiplace chamber, battery-operated devices do not belong inside of hyperbaric chambers unless A, they're medically necessary, or B, they've been tested to tolerate very specific pressures that would exceed anything near whatever the pressures of the chamber would be going to. One example of that might be a pacemaker. A pacemaker is a medically necessary battery-operated device, and as long as that pacemaker has been tested to 4, 5, 6 atmospheres, then going to 2 atmospheres in a chamber would be appropriate. In this case in Arizona, there were a number of battery-operated electronics inside that chamber that were not medically necessary and likely never pressure tested to withstand whatever pressure the chamber was going to. Why aren't batteries allowed in a hyperbaric chamber? Particularly lithium-ion batteries, but this is really across the board. Batteries are sensitive to pressure changes. The same way when you fly, they ask you, do you have any lithium-ion batteries in the luggage you're putting under the plane? Why do they ask you that? Because the plane will experience pretty dramatic changes in pressure. And we know that lithium-ion batteries do not respond to pressure changes well, and that those pressure changes may lead to a battery fire. Why are they allowed in the cabin but not under the plane? One of the reasons is because if it's under the plane, nobody would know about it, nobody could do anything about it. Whereas if it's in the cabin, they have fire-rated bags that this battery fire could be placed into to contain that fire. The other reason is that the cabin is pressurized. And so the extreme pressure changes in the cabin are actually less than the extreme pressure changes under the plane. So that those pressure changes are actually being minimized inside the cabin. So in this case in Arizona, this was not a static spark like it was in Michigan. This was a pressure-related lithium-ion battery fire. Also, if we think about lithium-ion batteries, we don't know how they were built initially, and how well do we all take care of each of our lithium-ion battery devices? Do we only charge them when they're low, or do we charge them overnight, all night? Do we always use the charger that came with our device? Or do we use chargers from different devices and interchange which charger and which device we're using, some of which may undercharge and some of which may overcharge that battery? How often are we overcharging those batteries? What's the health of that battery? How long have you had it? How many charge cycles has it gone through? All of these things impact the health of the battery. Now we go in an airplane where pressure is increasing and decreasing. A healthy battery is less likely to have a problem than a consistently overcharged battery. But also a battery that's seen repetitive pressure changes is more likely to have a problem than one that is only seeing pressure changes for the first time. We've all heard of fires on airplanes with regard to phones and tablets. In fact, there are probably many more device fires on airplanes than you're even aware of. An interesting finding was also the more frequently somebody flies, the more likely they might have a battery fire on their device because of the repetitive increases and decreases in pressure. But does anybody actually fly 4 to 6 times a week for 8 to 10 weeks the way we do a hyperbaric protocol? In other words, think of how many increasing and decreasing pressure experiences a device may have if it was being brought into a chamber for an entire protocol. It's incredibly dangerous. These battery devices have no place inside of chambers, period, end of story. The fire in Arizona was not a static fire. The fire in Arizona was a battery fire. And a battery fire cannot just be extinguished. It's not like a piece of paper on fire that you're putting out. A battery fire needs to burn itself out. And so here someone would be inside of a chamber. You cannot just open the door. You can't open the door until you depressurize the chamber. And you're in there with a fire that is not extinguishable. Fire is also hot. As temperature increases, pressure increases. So even if somebody was in a chamber with a fire and they were trying to depressurize the chamber, they're fighting the fact that the heat is also building the pressure. And so getting out of a chamber in that scenario is incredibly difficult, potentially impossible. This is not a situation that anybody would ever want to find themselves in. Even to this day, I see videos and social media posts where people are clearly utilizing a device inside of a hyperbaric chamber, and I beg you, I implore you, please stop risking your life. It's just not worth it. To date, the Arizona accident has been deemed an accident, whereas the Michigan accident is still under investigation, and some of the folks involved are facing criminal charges. Perhaps we will learn more about the Michigan and maybe even the Arizona accident over the next handful of months. However, what's clear is this: like every other accident in the hyperbaric industry, there were deviations from the standards, from the rules, from the regulations that have governed the hyperbaric industry for decades. This is exactly why we've spent time now over the last few weeks talking about the state of the hyperbaric industry, talking about compliance, the rules and regulations of the hyperbaric industry, talking about the recent accidents inside the hyperbaric industry, because I know how powerful this therapy is. I've experienced in my own life, in my family's life, and in my patient's life, the changes that can happen by going through a safe and effective hyperbaric protocol. Hyperbarics is one of the most underutilized yet powerful therapies available to the public. And if we want hyperbarics to continue to have this type of growth well into the future, then we all need to get compliant. We all need to follow the rules and regulations. We all need to self-govern and be accountable to one another and help each other enforce the rules and regulations of this industry so that hyperbarics can continue into the future, helping hundreds of thousands or millions of more people into the future. But that's only going to happen if we take this seriously, we follow the rules and regulations, and we help one another grow, not just grow the industry and grow patient access and grow patient awareness, grow in terms of safety, grow in terms of policies and procedures, and grow in terms of accountability, that we're doing the right thing for ourselves, we're doing the right thing for our staff, we're doing the right thing for our clinic, and we're doing the right thing for our industry. And of course, doing the right thing for our patients. If you care about this industry anywhere near as much as I care about this industry, I need you to do the right thing, whatever that might mean for you. Without judgment or criticism, evaluate what it is that you're doing inside your clinic. If you're a patient, evaluate, ask questions of the clinic that you're going to. Understand what the risks are, understand how to manage those risks, and make sure that you or the clinic you are going to are taking the necessary steps to maintain a safe clinic, an effective clinic, where patients can come and trust the policies and the procedures, trust the staff and the faculty and the technicians running the equipment, and know that they're going to have a safe and effective experience at this clinic. At the past IHA conference in September, I put together a compliance checklist for all the clinics. What's the minimum baseline of compliance required to operate a hyperbaric clinic? So if you weren't there or you're still wondering what the answers to those compliance questions are, you can either scan the QR code right here or click the link in the description below, and I'll give you our compliance checklist. All the things you need to be doing to make sure that you are compliant inside your clinic. And in fact, one of those things is having a safety binder. We're also including the safety binder table of contents so you understand what ought to be included inside of your hyperbaric safety binder. So please download those and start evaluating your own situation and start making sure that you're checking all the boxes. Thank you so much for your time and attention. Thanks for taking this dive with me. I'll see you on the next video.